As kids return to school, most of the area counties are mandating masks for students. Joining us to talk about COVID-19 masking guidelines is Dr. Theodore Bailey, Chief of GBMC's Division of Infectious Disease. Welcome to the show today, Dr. Bailey.
Good morning.
All right, so can you tell me how dangerous is the Delta variant for children?
Well, we do see increasing numbers of infections, and I think a higher percentage of the infections that children might get might translate into symptoms and translate into illness. So of all the variants that we've seen, this is the variant that we're the most concerned about.
Okay, so when do unvaccinated children still need to wear masks?
Well, right now, one of the things that we know is that even vaccinated children and vaccinated people with the Delta variant are able to shed it in quantities comparable to what an unvaccinated person would do. And so part of it is not just protecting yourself from acquiring it, but if you have it, don't have symptoms, don't know you have it, you're going to be less likely to spread to your classmates, and then maybe bring it home also to your family. So it really is important, vaccine or no vaccine, to be using the masks in a school setting.
True. Okay. So for kids who are already vaccinated, why is it important for them to still wear masks in the classroom when they return in a few weeks?
Well, so there's the ability to acquire the virus from another vaccinated child near you, acquire it, and take it out into the community and contribute to a community level spread. And so since this is going to be, hours upon hours of sort of close proximity, this is a place where with the Delta variant, there's the ability for somebody to bring it in without symptoms, spread it to somebody who also won't have symptoms, and then spread it out back into other families and elsewhere in the community.
Okay, Dr. Bailey. So how will masking be possible for students during lunch, gym, and stuff like music class?
Well, so we have to think about masking a little bit like seatbelts. The more you wear a seatbelt, the larger the percentage of time that you spend in your car driving with a seatbelt, the more protected you are. It may not be possible to wear the mask 100% of the time. There are certain activities like lunch that you mentioned that don't lend themselves to it. But the more you can wear the mask, the less likely you're going to have the virus, and then therefore the less likely you're going to be able to spread it, say, during lunchtime. And I would say for lunchtime protection, the schools are going to be needing to look at ways to reduce risk without masks. So some activities may need to have supplemental measures to prevent transmission.
Okay, so do you have how can we find out more information in regards to masking for children in schools?
So that's going to be both the individual school district itself, because I think in Maryland, there's been a strong commitment to individual school districts, sort of looking at their local issues and making their decisions, but also looking at state requirements. Those may develop over time. So just looking to the governor's office for what their recommendations will be. He's been working in close proximity with public health officials. So that would be really the two sources, your local school district and the governor.
Okay. All right. Lots of great information. Thank you so much for joining us today, Dr. Bailey.